Hello everyone, I am Dr. Sony Mehta. I am a practicing urologist and andrologist. My purview subjects include in the entire genitourinary tract in males and females, and along with that I also deal with andrology that includes male sexual dysfunction and infertility related problems. Today I'm going to focus on issues pertaining to prostate. So briefly I would want to divide the issues of prostate with respect to the age of the population. Generally, what issues people face till the time of 50 with respect to the prostate and beyond 50. Generally, in younger population, there is a disease called as prostatitis. Technically speaking, it is nothing but an extension of urinary infection. The reason it is special is because the infection happens in your semen or your sperm, that is commonly known as. The treatment is a little difficult, but there are ways to tackle it with respect to antibiotics and many things. The common symptoms that a patient has with respect to prostate infection is occasional burning sensation, or in absence of burning sensation, some frequency, urgency, which may get aggravated with sexual activity and otherwise throughout the day. The treatment definitely requires an expert clinical acumen and proper evaluation with respect to a few semen cultures, multiparametric MRI of prostate, and so on and so forth. So whenever you get that kind of symptoms, you definitely require medical attention so that it doesn't progress into a long-term issues. Another thing that patients of more than the age of 50 face with respect to prostate enlargement is there are urinary symptoms with respect to blockage of the urine flow. You feel that the urine flow is not very fast. You feel that you are not able to empty the urinary bladder better, and in spite of passing urine, you feel that some urine is staying back. Also, there are something called as irritative symptoms that in spite of very little urine inside the bladder, you may feel the continuous urge to pass urine in the daytime and in the night time. The nighttime thing is also commonly known as nocturia, where you have to get up more than once throughout the night to pass urine. So these symptoms are all technically related to blockage of your urinary bladder by the prostate. Now, to deal with the prostate enlargement in elderly patients more than 50, where we generally rule out infectious causes, is A, by medical treatment, and B, by surgical treatment. Medical treatment involves the use of multiple tablets, for example, alpha blockers, dutasteride, and all those molecules, to make sure that your flow simplifies. It's a continuous long-term treatment. Generally, it requires the supervision of a urologist at least once a month to see how the patient is faring. As far as the surgical treatment is concerned, the commonest indication or the need to undergo a surgery is that in spite of medical treatment, a patient is still complaining of obstruction or blockage to pass urine, namely poor urinary stream, straining, incomplete voiding, not able to empty it in one go, need to pass urine again and again, dribbling of urine. These are something which is very commonly seen in obstructive symptoms of prostate enlargement. Whenever you have this kind of symptoms, definitely do not ignore it. You require urgent medical attention, as whenever we try to ignore any symptoms in our body, there are compensatory mechanisms by other organs which eventually get damaged permanently. So, whenever such kind of patients come to us in the OPD, we ask for a routine ultrasound scan, urine test, PSA test, and all those things. In spite of medical treatment, if the patient is not faring well, they are asked or they are given an option to undergo surgical options. Absolutely are safe. They are very advanced. The contemporary type of treatment for prostate enlargement, surgical treatment is very advanced. For example, we have the best possible options at SL Raheja Fortis, that is known as thulium laser evaporation of prostate and holmium laser evaporation of prostate. In common terms, these are removal of blockade caused by the prostate gland with the help of laser. It's a 40 to 45 minute surgery. We do it in a bloodless way. Patient is completely pain-free, and post-operatively the recovery is very, very easy. Now, whenever this kind of symptoms arise, and let's suppose if we avoid or ignore surgery, what happens is the urinary bladder eventually becomes weak. When it becomes weak, and then when you decide that, let's go ahead with surgery, at times the ship has already sailed. In that situation, surgery might not help. So, let a urologist decide when is the right time to go ahead with it, and thereby a regular follow-up, a basic evaluation is absolutely must as early as possible the moment you have your symptoms.